Hey guys, it's Dr. Roberts from Nashville Neck Back, and I know it's been a while since we've done some YouTube videos, but I'm really excited for this content that we're getting ready to put out. So I get this question all the time in the office from patients. What type of exercises and what type of stretches should I be doing at home? So we're going to go over all that coming up next. So what type of exercises or stretches should you be doing at home and what should you not be doing at home? Again, I get that question all the time. So we're going to be putting together a lot of package videos with several exercises or several stretches for a specific diagnosis that you can refer to. But I'm also going to be publishing each individual exercise or stretch as a YouTube short or just a snippet or clip so that you can refer to that if you want that specific exercise or stretch. So in today's group of videos, we're going to be doing some specific exercises or stretches that relate to cervical disc issues, such as bulges, herniations, radiculopathy, and all that means is you've got a symptom caused by irritation of a nerve in your neck, and that symptom travels down your arm. And typically that can be like a numbness or tingling, a burning, a shooting, weakness. Any of those or a combination of those can be traveling down your arms, or sometimes it's just in your hands. So if that sounds like what you're dealing with, pay attention to these stretches and exercises coming up next. This exercise is called cervical retraction. It's a super easy exercise. It's very effective for cervical issues. And all you have to do is face a wall, focus your eye on something on the wall so that you can keep your head straight. You don't want to be looking up or down. This is a forwards and backwards type of motion, and it looks something like this. So again, look straight ahead, bring your head back. Now, when you do that, I want you to hold that for about 10 seconds. You're going to do that 3, 4, maybe 5 times. So again, it's just forwards and backwards like this. Now, if you want to add a little advanced technique on that, when you bring your head backwards, take your hand, force your chin backwards even further, like this. And again, hold that for about 10 seconds. Do that 3, 4, 5 sets, and it's going to help. Okay, so this is the cervical rotation stretch. Very simple. What you're going to do is you're going to turn in one direction as far as you can physically turn. Now, once you get in this position, take your hand and put it up against the side of your face. And what I want you to do is try to turn your head back against the force of your hand a couple of times. And then once you do that, use your hand to force the stretch even further like that. And what you're going to notice is after you kind of put that resistance back against your hand, you can usually stretch a little bit further. After you've done one side, simply do the other side by turning. Again, take your hand, try to turn your head back against your hand, and then use your hand to force the stretch even further, and do both sides. For the cervical rotation stretch, do both directions 3 times. This is the Levator Stretch. What you're going to do is you're going to turn your head in one direction and look downward. Whichever direction you're looking, take that hand and place it on the back of your head. With your hand, you can pull down just a little bit further, and as you do that, I want you to take your head and try to force it in the opposite direction against the pressure of your hand. Hold that for about 10 seconds, and then after you do the resistance, then pull back down, and you can probably get just a little bit more of a stretch. Do that on both sides, 3 sets of 10. Okay, so this is called the radial nerve floss, and this is going to be very specific for patients that have symptoms that are traveling down their arms or in their hands. And whichever side that's bothering you on, that's the hand that you're going to use. So I'm going to step back here a little bit so you can get a little bit more of a visual. This one's kind of weird looking, but what you're going to do is whichever hand or whichever arm's bothering you, that's the one that you're going to use. You're going to put that hand close to your chest. And what you're going to do next is tilt your head away from the affected side, and then you're going to look down. And as you look down, you take your hand and do what's called the butler tip position. So hopefully you can get a good visual here, and it's going to end up with your hand kind of like that. So it's all one fluid motion. It looks weird, it feels weird, but it is very effective. So again, you start here, tilt, and look down, all in one motion. You're going to do 10 reps of those, 3 sets of 10 on the affected side. Okay, so this is the median nerve floss. What you're going to do is you're going to take the hand that's on the affected side and you're going to tilt your head away from that side. So for this example, right arm symptoms, I'm going to be using my right hand. So what I'm going to do is I'm going to tilt away from that, start with my hand near my chest, and I'm going to bring my hand down. And as I bring down, I'm going to extend my wrist back. Now, for my head, I'm going to follow that with my eyes. And as I come back up, I'm going to tilt my head back to the opposite side. And again, it's just one fluid motion, over and over. You're going to do that 10 times, 3 sets of 10. Okay, so this is the ulnar nerve stretch, and you're going to perform this on the side that you're having your symptoms on. So for example, if it's my right arm, I'm going to stick my hand out as if I'm going to give somebody a handshake. Now with my thumb and index finger, I'm going to make the OK sign. Now, as I bring my arm up, I'm going to try to flip that over backwards and put that up against my eye. So it's not like this, it's actually the opposite way. And no, I can't do it. I'm not flexible enough. I can't do it with either side. It's something like that. So you at home, first of all, no making fun of Dr. Roberts in the comments below, but just do as I'm telling you, not as I'm showing you. But it's very simple if you're flexible, but I just can't do it. It's something like that. So